I just I just want to thank everyone for coming to this presentation and allowing me to speak about my professional development presentation on the importance of body image at the middle school level, specifically for females. So what is the definition of body image? It's what you believe about your own appearance, your memories, your assumptions, your thoughts, and your generalizations. It's how you personally feel about your body, including shape, height, and weight. And it also includes how you personally feel about your body, not only how you perceive it or look at it in the mirror. So I want to talk about, since the main purpose of this presentation is talk about what is a negative body image and body dissatisfaction. So it's a distorted perception of your body shape, how you perceive parts of your body unlike they really are. It's how you look at yourself in the mirror, and how girls will become obsessive on negative comments and self-scrutiny about themselves. The individual is convinced that other people are more attractive and that your body's size or shape is a personal failure. The individual experiences emotions such as shame, self-conscious, insecure, anxious, awkward, unhappy, uncomfortable in their own body. Overall, this leads to extreme body dissatisfaction, which is unhappiness in your own body. So what is the importance of learning about body image at the middle school level? Because middle school is a critical period in which they're going through adolescence and they're establishing an identity, individual identity, and they're connecting this development of one's identity to physical development and their physical appearance. So that's taking a center stage in their lives, and they're becoming obsessive over how they look. So the physical changes that girls experience during their adolescence may factor into the increased prevalence of negative body image and body dissatisfaction. So a statistic that I found was 80% of girls are convinced that they should be thinner because they are displeased with their own body image. Why should we be concerned? Because body dissatisfaction and negative body image is acknowledged as an alarmingly pervasive problem experienced by a large portion of females in our society, but specifically in the middle school level, there's a high rate of girls developing a negative body image. So the desire to be thin is so prevalent among young women that it has been identified as a normative discontent. Research has targeted adolescents, which is 10 to 14 years old, as the age of onset for developing a negative body image and body dissatisfaction. 42% of middle school girls are cautious about what they eat on a daily basis, which is consuming their lives. 81% of 12-year-old girls are afraid of getting bigger, so they begin dieting at an early age. 45% of girls believe that they are overweight, even though majority are at a normal weight range. And it's becoming so prevalent that young girls are more fearful of becoming fat than they are of receiving cancer, a war occurring, or losing their parents at an early age. So what influences a negative body image and body dissatisfaction? To start off, friendship groups and peers play a huge role in identity formation and body dissatisfaction. A girls' social group has the biggest influence on promoting a negative body image due to competition and heightened pressure to fit in and to belong. Girls will compare themselves with their friends through their scales, clothes, or their jean sizes, which is ideally they want to be a size 2 or 0, and different photographs. Adolescents believe that peer acceptance and popularity is correlated with a desirable body shape and type and being slender. In grades 6 through 8, 30% of females report being teased and criticized by their peers and friends about their weight. They said that they felt judged, ridiculed, name-called, such as being called overweight or fat, and that they point out flaws on their body. As a result, they have a strong desire to lose weight or attain a different body type to be liked and accepted by their friends or peers and the opposite sex as well. The role of peer pressure or friendship groups of fitting in played a significant role in eating disorder symptoms long-term, lower life satisfaction, feelings of inferiority, high levels of self-hatred, depression, anxiety, mood swings, low self-worth, and a very low self-esteem. So another factor that influences a negative body image is mass media. it provides a significantly influential context for adolescents to learn about body ideals and the value of what it means to be attractive. So because the average teenager spends about 23 hours a week on some form of mass media, they're consistently exposed to magazines, television shows, movies, internet, books, commercial ads, and this contributes to the consistent pressure to become slender because it's a foundational aspect of what it means to be beautiful, what it means to have a perfect shape, size, attractiveness, strength, and the ideal weight. The thin, ideal woman often portrayed in the media are typically 15% below the average weight compared to the unrealistic standards of what it means to be thin. So that's what they're representing. 94% of female characters in television shows are skinnier than an average American woman. Actresses and models depicted on television shows, magazines, and commercial ads has about 10 to 15% body weight, whereas the average body fat for a healthy woman is 22 to 26%. These young girls idealize and internalize what they see in mass media due to social comparison and body image self-discrepancy, where they're misperceiving what it means to be beautiful, what it means to look beautiful. 47% of adolescent girls reported wanting to lose weight because of what they see in magazine pictures such as models and actresses, and 69% of adolescent girls reported that television shows and movies influence their idea of what it means to have a perfect body shape. So the effects of a negative body image. Mass media and peer pressure can shape a young girl's mindset that they become biased against their own body image. In turn, most girls at some point feel fat, worry about their weight, or develop ambivalent, negative feelings about food and themselves, what they look like. Many girls may develop depression, anxiety, mood swings, low self-esteem, self-hatred, body dissatisfaction, shame, guilt, and even suicide at times. As a result, over 1/3 of adolescent females report aggressive weight control behaviors such as chronic dieting, excessive exercise, self-induced vomiting, abuse of laxatives, diet, aids, and water pills. And overall, 85% of females may develop the onset of an eating disorder, which is anorexia nervosa, bulimia nervosa, or binge eating by age 20 because of a poor body image. So I just want to give a brief overview of what some of the eating disorders are. Anorexia also, or anorexia nervosa, also called as anorexia for short, is an eating disorder characterized by an abnormally low body weight, intense fear of gaining weight, and a distorted perception of body weight. Research suggests that 1% of female adolescents will develop this disorder. Bulimia nervosa is an eating disorder characterized by frequent episodes of binge eating, and then followed by frantic efforts to avoid gaining weight. Research suggests that 1.1 to 4.2% of female adolescents will develop this disorder. And lastly, binge eating is regularly eating far more than most adults in a certain time period and in certain circumstances, and feeling that one's eating is out of control during a binge episode. And I just wanted to highlight that eating disorders have the highest mortality rate of any mental illness. Also, I just want to state that since school counselors are not qualified to diagnose a student with an eating disorder, but if we are we think or we see the students and we have a feeling that they might, we definitely should refer immediately, since eating disorders are very, very dangerous to develop. So what are some school counseling interventions at the middle school level? So school counselors should develop an environment of acceptance and safety that promotes personal health and strength. Previous research found that programs that address self-esteem was effective in decreasing body image dissatisfaction by promoting attitudes of appreciation, admiration, and self-acceptance through self-talk and positive I statements. School counselors can be created by addressing perceptions, wellness, affect, health, and health behaviors to promote a healthier body image. School counselors could facilitate group counseling for young girls to build a support system and facilitate connections through hearing other girls' like personal experiences that they've been going through the same thing. Interpersonal therapy could focus on developmental changes and social experience that may trigger a negative body image by learning how to develop alternate ways to handle problems and practice healthier behaviors. Also, school counselors could utilize a cognitive behavioral approach where irrational thoughts about your body are recognized, analyzed, and restructured to a more rational, positive self-talk. Action-oriented activities could be beneficial in helping students envision themselves as strong and doing activities that help them feel good about themselves and their bodies. School counselors should also educate physical education teachers on the effects of negative body image to incorporate classroom guidance curriculum on building endurance, strength, appropriate exercises, and cardiovascular. School counselors could also integrate psychoeducational classroom guidance lessons on how to maintain a healthy body image and how to avoid negative factors that influence a negative body image, and as well as negative behaviors that are not healthy. Lastly, school counselors can suggest an in-service education for faculty, different teachers, to become aware of normal developmental issues that middle school girls are going through at the time, recognize and report verbal harassment about body image, and how the importance of body image could create a staff sensitive to all students. I just wanted to add a healthy body survey that school counselors have utilized in the past that they found beneficial when they had a student that that were struggling with a negative body image. So the ASCA National Standards for Students, the American School Counseling Association's National Standard for Students, values personal and social development that is dedicated as an entire section of the standards to outline how it should be addressed in schools. So one big section that I incorporated was the personal and social development that school counselors should abide by. So this guides the school counseling program to promote the foundation for personal and social growth as students progress through school and into adulthood. So I just highlighted or bolded some of the ones that I thought were really important. So school counselors could help students develop positive attitudes towards self and as a unique and worthy person. Understand that change is a part of growth, that school counselors should encourage students to identify and express feelings, to distinguish between appropriate and inappropriate behaviors, to recognize, accept, and respect, as well as appreciate individual differences, understand the consequences of decisions and choices, demonstrate a respect and appreciation for individual and cultural differences, know when peer pressure is influencing a decision, identify alternative ways of achieving different goals, differentiate between situations requiring peer support and situations requiring adult professional help, learn how to cope with peer pressure, learn about the emotional and physical dangers of a substance abuse or abuse in general, learning how to cope by different skills with managing life events. I highlighted identify long and short-term goals. So all of these are really important, but as you will see, I just bolded some that I thought really related to this presentation. But I'm glad that I did this PowerPoint presentation. I hope everyone learned something and that we can incorporate what I incorporated in the presentation. We could use this when we are confronted with a similar issue in the school. And I just thank everyone for taking the time to listen to me speak about my professional development presentation, and I hope you all have a good day.